America's health insurance plans, an overview. Goals. America's health insurance plans, AHIP, believes that attaining quality health care constitutes the efforts of insurance providers and other parties in the broad medical sector. Essentially, the organization has been instrumental in curtailing the conflicts between insurance companies and entities. Part of the group's initiative includes creating awareness campaigns for equal access to medical insurance. AHIP also advocates for community development programs to deliver quality medication for all groups in the country. Objectives. To advance the aforementioned goals, America's health insurance plans has designated various objectives enshrined in its activities. Crucially, the organization recognizes the critical roles played by the private sector in advancing quality care and providing affordable medical coverage. Also, AHIP sets to promote the integration of all through equity. Furthermore, it focuses on protecting the value of employers' coverage plans to promote the mandatory coverage of employees. Vision. The undertakings of AHIP are guided by its vision of harnessing the might of collective expertise aimed at ensuring good health for all Americans. The organization has previously mediated between health organizations and private insurance companies to ensure cooperation for the greater good. Also, it has attempted to integrate innovativeness in its core programs through technological advances such as social media. Mechanisms used to influence policymakers. Medicare Advantage provides better financial security and reduces costs for taxpayers. Developing health equity aims to promote the inclusion of all American members, while expanding the Affordable Care Act aims to improve an established health insurance affordability fund. The association aims to support the value of the private market by enabling everyone access to high-quality, comprehensive coverage to protect their health and financial security. Lastly, AHIP promotes the value of Medicaid-managed care by making prescription drugs more affordable for states and taxpayers. Key obstacles. Rising healthcare costs have been a financial burden for many families for too long in America, especially for marginalized communities. Medical ethics and medical fraud include billing for services not rendered. The organization also faces financial challenges in running its programs across the country and other parts of the world. Continued support from various stakeholders is vital to keep the group functional and effective. Healthcare spending evaluation. America's health insurance plans assesses where the expenditure of healthcare funds is in the country. Accordingly, 81.6% of medical services funds are spent on medication and medical services. Such funds are critical in providing quality care to all Americans and the actualization of the national health goals. AHIP also relies on donations and funds from various entities to run its activities. The Center for Responsible Politics estimates that it raised $294,746 and spent $348,000 in 2020. The money was crucial in running national programs and pushing the organization's mandate. America's health insurance plans expenditure. According to the Center for Responsible Politics, AHIP spends most of its funds on campaign expenditures. In 2020, the group spent an overwhelming $284,500 on federal candidates. This contribution is vital as it fosters the growth and implementation of the organization's objectives and political agendas. The association relies on various vendors for various supplies as documented by the Center for Responsible Politics. Such disclosure is essential to promote transparency and accountability. Collaborative mechanisms. The association has continually launched various initiatives to push its medical insurance agendas. In 2019, the lobby group launched Project Link, a mechanism to spark teamwork among health insurers. Such collaboration aims to create an avenue to address the social issues hindering the provision of quality and affordable care for all Americans. The organization also launched transportation and healthy food campaigns to promote the well-being of marginalized groups, especially those who cannot access transportation to the nearest medical institutions.